what is digital, what is it not, and what better than the folks on this panel to talk about what digital means to us. So I think I'm going to start, Dion, by asking you, what does digital mean to you, and particularly in a healthcare setting?
Thanks, Ian. So first of all, I'm Dion Rogers, Chief Nursing Informatics Officer, and I guess my role in the digital programme is to really bridge the communication between traditional sort of what we would know as IT teams, which has now broadly changed across the patch, and the clinical staff being the voice of the clinician. But you've asked me what is digital, and I've got sort of four things that I think digital is in relation to healthcare. One is empowering care, so it's empowering care for the patient to actually take control of their care. You know, at the moment we run very much a nanny state kind of health service, and actually for me digital gives us the opportunity to empower patients. The other thing is intelligent health, and I know Kenny's going to come on to talk about this later in the week, but really the use of data. I'm super excited about the use of data and how in healthcare we can really use that to sort of intelligently improve and transform care. The other aspect is smart care, so things like robotics, things like artificial intelligence. I've recently seen some artificial intelligence that looks at predicting COVID patients, looking at COVID patients' x-rays and actually predicting whether they're going to deteriorate. So that's helpful in, you know, some of the research that's going on, and actually, you know, even more than the human eye, it can be more accurate. And then, you know, digital enables us, and we've already seen some of this at Kettering, to have care anywhere. So CareFlow Connect, for example, in the physician's hands, but also again back to the patient, and how can the patient receive care anywhere. You know, we've seen Mary has been able to join us today, but that's no different with healthcare. You know, why shouldn't we have more flexibility? And I think digital will help us to deliver that.
So very much patient, you didn't mention technology, very much there, very much putting the patient at the heart of what we do, and digital enabling.
Yeah.
And so maybe Anna, so obviously I've worked with you on many things, but one of the things I've been particularly involved in is virtual visiting, which puts patients and their families at the heart of what we can do, and not necessarily to talk about that, but same question to you, Anna, in your experience, in your professional experience, what does digital mean to you?
So just excuse my background noise, I'm in an office with somebody else. So for me, digital is, I say many things to different people, I would say, within the organization, and looking at the different types of kind of sectors within the NHS as a whole, it means so many different things, because when it comes to digital technology, people are at different parts of that journey, and digital to me is trying to ensure the patient is the center. Like you said earlier, the patient needs to be the person that defines what is going to happen to them. I think looking at outpatients, for example, is a very, very good sector in terms of, you know, I would say, you know, kind of delays and DNAs in that area. And looking at that outpatient area, unfortunately for us, we've not taken the patient on the journey with us to develop and design what we understand as digital. And I think we forget about the patient's story half the time when we talk about what is digital. I think it's connecting our services, connecting systems, connecting people, and not only connecting them, but connecting them intelligently. So what I mean by connecting them intelligently is ensuring that our primary care, secondary care, and any other care settings are all linked in. And I think traditionally, when you talk about communication, it has been the problem we've had. Now we're looking at digital technology, right? Look at Uber. Uber are able to connect people from thousands of different sectors, and they can get it right. They can look at the patient, the customer interface, and they can also look at the driver interface. So my question is, why is it that technology within healthcare, unfortunately, does not synchronize in such a way whereby primary care, secondary care, and all the other public health and all the other bodies out there are not synchronized? So I think the question to us at the moment is, it's not about just what is digital, it's about more around digital technology as a whole. How do we ensure it's holistic? How do we ensure technology can be interrelatable? And how can we ensure technology is patient focused.
I'm getting excited just listening to you, Anna. And look at that, a thumbs up from Dion. And actually, you've both mentioned data and intelligence and joining up. So that means we go straight to Kenny. So Kenny, we spent many hours joshing about spreadsheets and lookup tables and joshing about pivot tables. But what the heck does this mean from you? What the heck does health intelligence in this modern digital hospital setting mean? What does it enable?
Well, firstly, thank you to Dion and Anna for teaming me up very nicely there. And for me, digital, what that means in my sort of profession is just the sort of explosion of data that we have available to us. And not just the data that we have available, but also the appetite and the desire for people to understand what that's telling us, how we can use it to improve patient care. So I think there's been a real shift over the last few years from people just wanting information in terms of how many patients do we have, how many on each specialty code, etc., to really sort of wanting to know the insight and what this data is telling us. So it's not to say that, you know, for me, digital is about taking everybody on that journey with us. We don't want people just high-tech coders sat behind a PC, just, you know, not engaging with clinical staff and people, but it's how do we bring all that to life, because the data is meaningless unless we get people to engage with it and for it to drive action and get people excited by it, really. And I think for me as well, digital has really sort of put analytics and intelligence to the forefront. I think going back a few years, it was quite often an afterthought where you'd maybe launch a product or a digital solution and not really give much thought to how you would sort of track how users engage and interact with that. And then, you know, you'd be playing catch up. But I think now there's a real sort of understanding that we need this information to continually improve the products and services that we deliver. So it can never sort of be an afterthought again, because once you go live with something, the first questions you're going to be asked is, how are people using it? What, you know, how can we make this better? We're not launching finished products. We're launching a product that we can iterate, and we can only do that through user feedback and through data and analysis.
That's great, Kenny. And I was going through my mind there. Well, this sounds exciting, and data and intelligence, and you've already said you're excited. But Mary, you've got a job title, head of ICT. So what's different from what would have been a head of ICT or a head of IT 10 years ago from now? Are you just the fuddy-duddy bit of us making the wires and the technology work, or no. What's your?
Yeah, it's all about mindset for us. So, you know, 10, 15 years ago, IT used to deliver what they thought or felt that their business needed. It was, we're IT and here's what you're getting. And we've actually flipped that on its head now. What we do are the discoveries with the business. We check what the patient requirements are. What is the impact of the clinical teams? What is the problem they're trying to solve? And how can we make them do that? So that when they get these technologies, actually what they get is something seamless and simple, easy to use. They don't have to consider what IT. We're doing our very best to never impact those services that they're using, and to, you know, tie them all together, make sure that we're more agile in our approach. You spoke there about the iterative approach. You know, we provide something and then we make it grow. We look at that continual service improvement. How can we evolve it? How can we make it better? What isn't working for you? Looking for that feedback. You know, what didn't work? What worked well? You love, you want to keep, and then what didn't work so well? What would we do better next time? What will we do better? And how will we make things, you know, continue to grow and also always be available? You know, high availability is key for me, making sure, you know, we're looking at cloud technologies now as well, moving to cloud. And that's so that we can have these flexible workspaces. You know, we can actually provide agile, you know, I can work from the car, I can work from anywhere, I can almost work from my phone. It doesn't matter what the piece of tech is. It's just a case of that I can get to whatever it is I need to, regardless of what the actual hardware is. That should be irrelevant in the whole thing, really.
So what I'm hearing here, there's a common theme. There's people, putting patients at the heart of what we do. What you've described, Mary, and I'll never use the word fuddy-duddy again, is putting people at the heart of the services we deliver, iterating, releasing small releases if we can, learning and growing and changing based on what we know. And what I heard from Kenny is using that data and that intel to drive those decisions, the services we deliver, the services we grow. Cool, blimey, this is sounding like a whole loving. Hey, it fits the week. I love digital. And so, Christian, I remember when you started with us, I received a pile of books for you, the holy grail, as it were, of clinical coding, wrapped up in books this thick. And for those folks who may not know, well, Christy, why don't you tell us what clinical coding is and what your ambitious plans are to, I'm going to say digital, what has been a bedrock, I think, of hospitals for years.
Sure, thank you, Ian. I always associate, when I first started in coding, I walked into my, what was then a long galley office with rows of coders hunched over their books. I associated it with a kind of monastic vibe, but maybe that's just me. So in terms of what digital is for us in clinical coding, I suppose it would make sense, most sense, to frame that in a way of what has happened to us in coding. Coding is not typically associated with a digital portfolio in NHS trusts, at least in my experience. And there's two big things really that we could frame coding and digital around. One of them, this is a people focus, but our staff in this case has been allowing or enabling the distributed working model for our staff in response to the COVID situation. And one of the other big things that I would say, what is digital in the coding sphere, is enabling that future look, or soon to be here look at automation of the of parts or sections or the entirety of the coding process, and then allowing human minds to better do more fruitful work in terms of in-depth patient coding and auditing and data improvement in that respect. A big focus for us as well, another people focus, and this time on the patients. We aren't commonly seen as affecting patient care, but we're excited in coding because being part of the digital portfolio really G's us up for making that patient data as accurate as possible. Really accurately recording what's happened to the patient when they came in, why were they here in the first place, what's their history. Being part of digital has really got us on board with making sure that everything is tip top and all of that data is accurately representing what happened on the day for that patient.
So that's really interesting, because if you're watching this video playback, not only you're learning about how much we love digital, you're learning a bit about clinical coding and how important it is, and potentially how exciting it is using automation, artificial intelligence, and so on. That sounds cool. So Natasha, from your point of view, leading the digital programs, I guess you're a bit of the stuff that joins everything up, and at that heart, that intersection of technology, people, solutions, outcomes, and iteration. So what does digital mean for you?
Oh, how can I top anything that's been said before? So I'm hopefully going to maybe bring some of these themes together, but perfectly summarised by all the colleagues so far. So for me, digital is about people. That's at the heart of it. It's not just about computers and technology. It's not only what we work with, so that tech, but more holistically. So more holistically, how we use it and how we will benefit from it, both our patients, but also our clinicians as well, you know, as all of the colleagues so far have said. For me, it's about, and hence the link to digital programs and digital transformation, it's about changing the way we work, you know, being more agile, you know, putting user needs first, and reacting and responding quickly as well to those changing and evolving, I say, user requirements. You know, how can we also adopt some of the markers of our digital age? You know, we're living in a digital world, you know, not only in the hospital, but in society more outside of that. So how can we take some of those markers from the world that we live in? Anna's great example of Uber, you know, how can we adopt some of those cultures, some of those processes, some of the models, some of the mechanisms, some of the mindsets, you know, how can we adopt some of those and put them into how we deliver our patient-focused and clinician-focused service? That's it in a nutshell.
And I think myself and Dion were in a call early in the week talking about, I think the whole point of this week is to help people be confident with digital, to not be scared of it, and to build on some of the great training material we have available to help people become more comfortable with digital. But Dion, it was interesting the chat we were having when folks talk about those the people who may be disadvantaged, so the elderly or folks with dementia. But I know we've had conversations that says, well, actually, technology can be enabling and supportive for those folks. We'd like to just expand on that, because we don't. Digital is not just for those who are super comfortable and already there. You know, it is genuinely for everyone, and those people that traditionally you felt disadvantaged may not be so. You found that in your experience, Dion?
Yeah. So the conversation went around me visiting an outpatient clinic a couple of weeks ago and actually speaking to some of the patients that were brought into the hospital and looking at whether they would be happy to have outpatient appointments over video and asking them about their technology, etc. And there seems to be a very common assumption, and it is a real issue that, like you say, maybe people, not everybody has devices. Some people might only have a phone or not anything at all. And some people might not have had, you know, be brought up with digital like the new generations. But actually what I found was most of the patients that I spoke to had the technology that they would need. Even if it was just a phone, that was completely adequate. And a lot of, it seems like a lot of families are buying their elderly relatives, you know, particularly around this timing and where people can't physically see each other. It seems to have, you know, happened by osmosis or almost, that people are, you know, grandchildren are buying grandparents and teaching them how to do things. So I think, yes, there is some inequalities out there. It's really important that we seek out to find those people and bring them along with us. And I mean staff and patients around this. And in a later session today, myself and Anna are going to talk about our Digital Ambassadors programme, which is really geared up to seeking out those people that, you know, are not necessarily really tech savvy, may have some real fears around technology, and indeed may not have the devices that they need to connect with people. You know, this is a completely inclusive plan that we have going forward, but really encouraging.
And yeah, I'd like to add to that, just because one of my responsibilities in my role is about addressing or overcoming or even just spotting health inequalities. And I'm digital to the core, I like to think. And I see absolutely the digital half of me, as it were, enabling that health inequalities, whether it's traveling communities, folks with mobility issues, elderly folks, folks with dementia, folks in care homes. I see it absolutely. So as well as people, as well as data, as well as iteration, there's absolutely inclusivity and including everyone in all that we do. Okay, and look, now we have Mary. Sorry, go on, Dion.
Sorry, and it's about providing options. This isn't us trying to railroad everyone into using digital. Sometimes it's necessary, sometimes it's a good thing to do, and sometimes it's not the right thing to do. You know, we all want to get back to seeing people face to face. So it's about providing options, yeah.
And so we could talk for hours about how excited we are with digital, but hey, you know, there's a clue in the roles we do. I just want to ask, is there anything that scares you about this, about bringing digital care to the hospital and the transformation we're trying to do? Anyone have any sense of being scared about anything, or are we just the type of folk who are positive, feet first, we're reactive, so when we come across something, we swerve, or we iterate, or we learn from what we see and we change? Christine, you put your hand up.
Yeah, I am. I'm casting aspersions, but probably like everyone else here, I'm fairly happy with the agility, and indeed, it's a major selling point. It's a strength, isn't it, from at least my perspective? So I wouldn't say too concerned around that. A fear for me would be more generally clinging or cleaving to tradition in certain areas, and a big cure for that would be approaching things with an open mind, working in collaboration with each other, and working toward the positive end goal of the trust. And digital really ties itself to that. So I say fear is probably tradition, but I think we have the panacea for that.
Actually, I think that's a really important point. And we've talked about cultural change, and that's why we're doing I Love Digital. That whole culture, we are the National Health Service, we are a service. It brings with it formality, management of risk, and obviously patient care at the heart of it. But we are about absolute change and cultural change, learning from our clinical partners, delivering solutions that meet needs. Anyone else want to say anything about being scared? Anna, your hand is up. You're never scared.
Yes. Thank you, Ian. No, it's more around paper has always been traditionally the cultural bedrock when it comes to how we document information. And I think as we are shifting during this digital kind of, should I say, transition, very soon we will get an era of people that will not understand how to use paper ever again. And I think it might get to a situation whereby we have care of people that, you know, we might have to start doing refresher courses of how to use paper, just in case the system was to go down or we were to have an outage. Because if we have an outage, there's no amount of technology you have, it will not work. And the question around it now is, if that apocalyptic type of thing happened within the health service or within anywhere within the world, will people still be able to look after their patients without any problems? I think that's my fear. It's more of a bigger thing, but hey.
And actually, just building on that, that does mean our focus on business continuity planning and how we react to outages and so on. I'm not going to say it has to be even more so, but it's a real key part for me of delivering transformation. And how do you then follow it up to make it sustainable and resilient in the way? So I'll roll out of EPMA for prescribing, I think, for me is the heart of this. So, and I see, Dion, you mentioned, yeah, absolutely, do not want to cause more stress to staff and patients, because sometimes our energy and our gung-ho-ness and our excitement, we can forget our colleagues who may be less so. I remember doing some work around automation and talking about bringing robots in, and the folks were scared actually because it was so alien to what they've done. 6 weeks later, they're so excited and they're so proud of Mary.bot, and that's that transformational curve. So Natasha, I think you put your hand up.
Thanks, Ian. Not so much a fear, but more of a challenge that I think we've all got, and this is around you know, the digital enthusiasm that you can see across the organisation means that how can we match that pace and expectation, you know, as that continues to grow, how can we continue to match the expectation of the business? But I suppose my response to my own challenge is, you know, digital includes all of us. It's not just this team, you know, it's the whole organisation. We're all part of that digital journey. And I'd like to introduce at this point, but I know it will come later in the week, around the great work that Dion and Anna and others are doing around the Digital Ambassador Programme as well, which really will make that digital team expand. And we're all part of this. So, you know, that's how we're going to face the challenge. We're going to do it together, and actually everyone's on board on that digital journey.
And I think just building on that, it's that trust, isn't it? That there's no such thing as a silly question, you know. You can ask anything, and we're all in it together. And even those of us who think we're digital experts, we all learn one day. And I know I've got a whole load to learn about the patient experience within an acute trust. Interesting. Anyone else? Actually, Anna, you've left your hand up, so this gives me the opportunity to record for posterity. Is that an old hand? No, I don't mean old. I mean, is that a legacy hand,
Yes,
it is a legacy
hand.
But Deanne has put up a new hand or a young hand.
Yeah, young hand. So I just want to sort of put it out there that I'd like to sponsor a little quiz going through the week. I'm going to sponsor a prize, and at the end of the week we'll ask people to put in a number of how many times through the Love Digital Week we have to tell someone you're on mute.
It's going to be triple figures, isn't it? It's got to be over 100.
Haven't had to do that today so far.
Not so far.
So far we're at 0, but as we go through the week, each day we'll log that up, and then at the end of the week we'll get people to guess how many times. It's the caption, isn't it, of the last year really, and I'll supply a prize to that person. So just a bit of fun. That's what we're about.
That's lovely. So actually, I think it was a really interesting chat, and it wasn't rehearsed actually, not at all. And I'd just like to say what a great team I have the privilege of working with here at Kettering. And so that's what we think about digital.